Hello, my name is Christina Welmaker, and I'm a senior exercise science major at Lander University in Greenwood, South Carolina. My research was done under the supervision of Dr. Jeff Barfield. For this research, we looked at the relationship between the kinematics and dominant and non-dominant hand touches during the closed kinetic chain upper extremity stability test. For this research, we started with the idea of the body is a multi-segment motion, and we took this concept that it is a kinetic chain. The concept of the kinetic chain states that segments within the human body are all connected as links of a chain, and therefore when one part of the chain moves, the rest of the chain follows, as in a domino effect. This concept gave us the idea that proximal stability is needed for distal mobility. And we were able to use the closed kinetic chain upper extremity stability test, which is a low-cost assessment, to test and measure the shoulder stability. However, instead of just looking at shoulder stability, we decided to take it further and look at the lumbopelvic hip kinematics and look at the relationship that they have on shoulder stability in a group of competitive baseball players. For this research, we took a population of competitive baseball pitchers and followed their kinematics during a dominant and non-dominant hand touch during the closed kinetic chain upper extremity stability test. We looked at the anterior, posterior pelvic tilt, axial pelvic rotation, and closed kinetic chain upper extremity stability test score. Our participants were 14 competitive baseball pitchers who are around the collegiate age, and kinematics were collected using the electromagnetic tracking system. Participants were asked to perform a closed kinetic chain upper extremity stability test where participants were placed in a push-up position with their hands 36 inches apart. In an alternating fashion, participants were asked to touch the hands of an alternating hand touch for 15 seconds, as many times as possible. An example of this can be seen in Figure 1 under the Methods section. 3 trials were performed with a 45-second rest period between each trial. Trials were averaged and kinematics were taken from the middle hand touch. Now, the middle touch was given to us from previous research and was identified as, for example, a participant did 30 hand touches during one trial. We would take the 15th and 16th hand touch to give us a dominant and non-dominant hand touch to look at. Data was analyzed using Pearson correlation statistical test. During our Pearson correlations, we were able to see a moderate significance between the dominant pelvis anterior-posterior tilts and the number of hand touches, as well as a non-dominant pelvic axial rotation when compared to dominant pelvic anterior-posterior tilt. Both of these correlations can be seen in Figure A and B. Both of these gave us the conclusion that the more neutral position that the pelvis was in during the middle hand touch during the closed kinetic chain upper extremity stability test, the higher the score the athlete had on the assessment. However, we were also able to see that there was a large, strong, significant relationship between the posterior pelvic tilt and the non-dominant axial rotation during a non-dominant hand touch. This relationship can be seen in Figure 3, Part C. However, a non-dominant hand touch, for example, would be looking back at Figure 1, Part C, and an athlete who is a right dominant pitcher. Now, this research is important because it helps not only athletes with rehabilitation issues, but it also helps them in everyday life, because we are able to see that since baseball is such a unilateral motion, that there is a bilateral discrepancy in the lumbopelvic hip kinematics. And previous research shows that the lumbopelvic hip kinematics instability causes more injuries in the shoulders in competitive baseball players. So there is more research needed to examine the lumbopelvic hip kinematics, and during the closed kinetic chain upper extremity stability test to determine how they relate to each other. Thank you.